This is Dr. Ryan Fader presenting Exploiting the Benefits of Postless Hip Arthroscopy, the on-off traction technique during labral repair to restore the labral suction seal. This procedure begins with a standard booting process with care taken to ensure uniform compression and avoidance of any major pressure points. Utilization of a Stryker Guardian postless system is demonstrated, as this is the lead author's preference, but this technique can be performed with a postless system of the surgeon's choice. The patient is placed into Trendelenburg position. Gross and fine traction are applied. Air arthrogram is not routinely used, but can be useful in select cases in which establishing traction is difficult. Access is then established via standard anterolateral portal with a Seldinger technique. An initial evaluation of the joint is performed. Modified mid-anterior portal is then established under arthroscopic visualization, and after cannulation, the camera is placed in the anterior portal for the remainder of the case. Interportal capsulotomy is then created to assist in visualization in standard fashion, and the capsulolabral interval is defined with a radiofrequency wand in preparation for addressing pincer and labral abnormalities. After addressing any pincer anatomy and rim decortication, anchors are then placed adjacent to the rim, spanning the area of the labral damage in a lateral to medial manner. Suture passage is performed largely in a circumferential manner, but translabral sutures may be passed based on the surgeon's preference. Here you will see multiple examples of the on-off traction technique, allowing for anatomic reduction of the labrum prior to repair. This is performed in a sequential manner with each anchor in efforts to restore the labral suction seal in the hip joint, which is allowed by postless arthroscopy as there are no compression points of the inner thigh or reliance on the fulcrum within the groin. Suction seal is visualized and analyzed with the placement of each anchor during tying. There are several videos demonstrating how this technique is utilized throughout the case to ensure highly accurate reduction of the labrum. The labrum is then inspected one final time to evaluate the suction seal. After adequate labral repair and restoration of the seal, peripheral compartment abnormalities are addressed, sometimes requiring a T-capsulotomy to assist with visualization based on the cam morphology. Post-resection evaluation is performed, as well as evaluation of the labral suction seal prior to capsular closure. The capsule is then routinely and completely closed. The lead author's preference is for 2 to 3 sutures in the T, followed by placement of 3 to 4 sutures in the interportal capsulotomy. All of these sutures are placed with the hip inflection and subsequently tied in extension to avoid over-tightening, but ensuring watertight closure of the capsule. We'd like to thank our co-authors and research assistants with the creation of this video. Thank you.